off. So we'll turn it to Leanna and get going.
So thank you everybody for joining us bright and early. It's great to see you all here today. Welcome to our webinar on strategies for increasing vaccine uptake in diverse communities and populations. And we have a number of wonderful guests, so I won't take too much of your time. Lisa already told you that we would be recording, but I do want to let everyone know that this will be placed up on the CDC website, where you can also find previous recordings of previous webinars as well. We've had a number of really wonderful guests share with us some of the strategies that they're employing in community. And so I would absolutely invite you to take a look at those. And if you missed part of this or have a colleague who missed part of it, you can find this one there later today or tomorrow as well. With that, I'm going to turn it right back over to Lisa to introduce our guests.
Great, thank you very much. And I am not seeing Sophia on here. Leanna, if you might want to just
I'll watch for her, sure.
Or I don't know if you want to ping her on follow-up email. I'm not sure actually that I have her cell, sorry. But we will go ahead and get started and hope that she's able to join. So we have been focusing on different aspects of COVID-19 issues related to disparities and trying to promote equity. And this month we're turning to issues of engaging youth of all communities. As you all know, the governor opened up vaccination to all eligible ages now, gosh, just over a month ago. And then FDA gave emergency use authorization to children 12 to 17 for the Pfizer vaccine. And so that hit just a few weeks ago. So really trying to think about how we continue to shape our efforts and the messaging to engage youth and importantly, parents, and again, across all communities and cultures. So with that, we've invited Dr. Geeta Rao from the Greater Portland Health and the Portland School-Based Health Centers, and Betsy Paz-Gamay, I'm sure I'm going to say that wrong, Gamisi, parent community specialist and multilingual, multicultural center at Portland Public Schools. And then we're hoping to also have Sophie Khalil from Gateway Community Services. Oh, thank you. Oh, there we are. Thank you. Welcome, Sophia, from Gateway Community Services in Lewiston, where she serves as a community program manager as well. So with that, we're going to turn to the real expertise in the room, which is them and all of you. And we're going to start with the colleagues from Portland and then go to Sophia and Lewiston and then open it up for discussion. So we'll hold questions till the end, but please feel free to use the chat to put in any comments or questions, and we'll get to that as soon as we can. So with that, Geeta and Betsy, I will turn it to you. And I'll also, should I share screen now, Geeta, for those 2 slides?
Sure. Yeah. So thanks for having us. I'll start us off, and Betsy and I have worked on this a bit together and are both going to share our experiences. So we both have some experience in terms of reaching out to teens and young adults to promote COVID vaccines. And my background on this is I'm a pediatrician at Greater Portland Health, so I have experience in individual visits with teens talking about the vaccine, and then also have done some broader outreach, much in partnerships with the wonderful school nurses in Portland to try to reach teens more broadly around messaging. Betsy, do you want to just tell them your role so people know your role in the district?
Sure. Hi, good morning, everyone. Thank you for having me. I work for a multilingual, multicultural department, specifically with the Latinx community. I am an interpreter and a translator, and I just help families connect to school, but also connect to community resources as well, and provide advocacy. So I work a lot when parents need connections to healthcare or anything like that. They'll usually call me to help them connect with the clinic.
Great. And so before we get into it, we approach this with a lot of humility and are looking forward to the discussion. There's so much that changes in this so fast. And so, I realize that many people in this group probably have, even more experience than I do, certainly in terms of COVID vaccine conversations. And so, so we're really delighted to be here and look forward to learning. So Lisa, you can put there's 2 slides, you can put them up. Perfect. Okay, so we're gonna just talk about our experiences in 3 different questions. So one is when we are promoting the vaccine, what teens are saying back to us. And when I say teens, we really, like young teens and young adults. And then we're going to talk about decision change. So when there's hesitancy for a teen, what makes teens change their mind about the vaccine? And then just ideas for how we can better promote the vaccine among young adults and teenagers more broadly. So I just put here so when this is like a line that, like the CDC encourages us to use. So I strongly recommend you get the COVID vaccine. I got mine as soon as it was available to me. And when we say those things, or Betsy, however you say those things, I'll let you start us off on just, a few of the types of responses you're hearing back from the community you serve.
So it's, I'm getting like a mixed response. There is a lot of fear, a lot of fear with a teen. I mean, just the other day, I think, Gita, I told you that, I was talking to her about, she was asking me, because I posted my getting the vaccine on my WhatsApp, because a lot of my community, this is how they communicate. So I posted that on my WhatsApp, and we are talking about it. And I said, so are you going to get your vaccine? Do you need help signing up? And her response to me was, quiero tener una familia, which translated means, I want to have a family someday. So it made me start thinking. So, with teens, there's that fear of, what's this gonna do to my body as far as for the future? And I think that's also parents talking to their teens. Like, I know a lot of moms are like, no, I want to be a grandmother. And, so teens are afraid on that end. They're also distrustful as far as, like, we all know, government stuff. So, teens are kind of, they're very honest. That's what I love about them. They kind of say exactly what's on their mind. And I had someone tell me, like, Senora Betsy, you really think you are going to get the same vaccine that the white people are getting? Which was, wow. So there is a huge distrust. So they're afraid. And it's also sometimes when I ask them, I'm like, hey, they're like, hey, my mom said no. So a lot of it also goes back to a parent saying yes or no. Would you not say, Gita, more or less? You're kind of...
Yeah, I think so. My experience has been quite similar. So certainly there are those, when we think about the whole community, there are teens that are, have quickly said yes. And those are tend not to be the ones that we're talking to, I think. Certainly the patients I see are mostly from immigrant families, a lot of them from families from Angola and DRC. And it's not a quick yes. And I think that, like, when vaccines became available for teenagers, certainly some were quick to access. But most of the responses I'm hearing, so I do hear a lot of the, let me talk to my parents. And specifically, it's interesting because, these are like 18 and 19-year-old young women and men who otherwise have never involved a parent in any of their medical decisions and have never, said anything about, have never really mentioned even a parent. And so it's just it's the first time, and they have received many vaccines, but this is the first time they've sort of referenced a parent. And then many who are saying, I'm just not ready. And many who are worried about being sick in the days after. And then, I think that's what's being told to me. But then, I'm realizing the underlying distrust is pretty powerful. So, and I think that's what's not often spoken to the providers, but is there. And so, Lisa, I do have, and we'll move on to, talking about sort of what we're doing in response to hearing this distrust, but I do have a quick audio clip. So this is one of the teenagers who I was talking to in clinic about the vaccine. And she's actually, she wanted me to hear her friend's take on the vaccine. So she called her friend from the clinic room, and then she interpreted his Portuguese. So, but I think this is what, teens are not often saying to me that is really underlying. It's about like 50 seconds.
Whoops. Let me try.
Are you sharing audio when you're sharing your screen?
I thought I was. Can you not hear it? I mean, I am, but if you can't hear it, that's probably my end. I don't know if Gita, if you do it directly, I don't know. Amy,
So
I'm doing it.
one thing I can do is, and if it doesn't work, we can also just move on. But one thing I can do is play it off my phone into the meeting. I don't know if that's.
Sure, why don't you try it, and I will just stop it from my end because I am playing it right now. But
Okay.
Not audible. So sure, go right ahead. Thank you.
Sure. Let's see if this works. I actually had to have the teenager tell me how to even do this off my phone because I'm not that savvy. Portland. Okay, so let me just put the volume up and see.
Basically, what he said is that there's rumors that says that the COVID-19 was strategically made to reduce a certain part of the population in the world. And basically with that vaccine, what he's scared of is that some countries are interested. He has hearing that some countries are interested in reduce the population in some parts of the world. Not only elderly, but also Black and immigrants and stuff like this. And also he heard that in our country, because the vaccine went to our country, but then it was making people sick. I don't know what kind of the vaccine it went there. So they removed it. And with that situation and all the things he have been hearing, he's scared that by taking the vaccine, he'll eventually get a disability, or that will impact his life or his way of being, or he will die sooner. That's basically.
And so the reason I play that is, I mean, I think we all know that that's out there, but for me, it's like, most people are not saying that back to me in visits, but it's profoundly there. And so, and Betsy, you would say that you hearing those sentiments more directly.
Very, very directly. So I don't know if maybe you guys are familiar with this, but for a lot of the Spanish speakers, and even like where I'm from in Cuba, right? Doctors and nurses are seen as part of the government. So, as much as, yes, you listen to what your doctor says and things, that also adds to that fear of the vaccine. So many have said very directly to me, I mean, seriously, when I posted that on my WhatsApp that I was getting the vaccine, I mean, I was flooded with calls of parents that were like, Señora Betsy, you really need to think about this. This is probably a plot, to just, and same thing, that fear of trying to get rid of immigrants. So, it's also, unfortunately, it makes it, I think, harder for health providers because that's the mentality that hospitals, health people, are government people as well back at home. So it scares you even more to get the vaccine. I don't know if I had mentioned that to you, Gita.
Yeah.
But so yeah, it's a big fear.
So I'm very sorry, I have to interrupt for just a minute. So Sophia just reminded me that she actually has to get off at 8. So if we could just maybe, Sophia, have you join in with any thoughts in response to that and what you're doing, and then we'll come back. Gita and Betsy, I'm so sorry for that.
No, that's fine. Yeah, absolutely.
Awesome. Thank you so much. Hi, everyone. My name is Sophie Khalil, and I work with Gateway Community Services as a program manager. I oversee the Youth Coalition. We're a 20-member youth from ages 17 to early 20s across the state, largely diverse and multilingual. And excuse me. And the coalition really started because of the pandemic, to really support community members and provide resources and other information, because in the early months of the pandemic, we saw a lot of misconceptions and a lot of misinformation that was being spread about the COVID. So the coalition really was there to support vulnerable community members with a lot of resources and information gathering. In terms of providing better COVID vaccine distributions among youth and immigrant population. The youth really have taken another level to vaccinate their friends and their families. As a gateway, we have been doing pop-up clinics in the community. So we are, we have been just reaching the youth and their families to get them to vaccinate and stuff. There are a lot of, even some of the youth that we have on the coalition, there's still a hesitancy to take the vaccine because of misinformation online, really. That's the biggest one. They are watching YouTube videos. They are seeing a lot of also hesitancy from their parents. So if the youth may want to take the vaccine, their parents may not want to take the vaccine. So there's that struggle of trying to like get the parent to take the vaccine, and then the youth end up not taking the vaccine because their older parents is not. And also, even my closest friends, I've taken the vaccine as soon as I was eligible to take it, but even my closest friends said they're not going to take the vaccine, unfortunately. And I think it's just, youth being youth and just rebelling, really, like a rebellious thing, not wanting to conform to authority and having a sense of like no, and not listening to authority, however that is. So those few things actually, it's really why some youth would not want to take the vaccine. Ways that we can combat that is I do a lot of social media outreach. I have a lot of following. So that's where I get a lot of my information out, especially on Snapchat. Snapchat has been one of the biggest one to promote vaccine outreach. I make videos and I do like the flyers, and a lot of youth swipe up to sign up for the vaccine or get their parents to. If there's particular youth that I know that haven't signed up, I message them privately and said, did you take the vaccine? Have you told your parent, etc.? That one-on-one relationship really helps. Another thing that I've done is I would know like several youth, and then they would know several other youth. So if I can just get one person to get another 5 people, that has been something that really has been working out, at least for the Gateway Pop-Up Clinic. And Instagram too. So Instagram and Snapchat has been 2 platforms that there's a lot of youth presence that we should all be using to get the word out. Yeah, that's it really in terms of ways that we can, get youth vaccinated.
Great, thank you. Well, thank you very much for joining us and for joining us as long as you can. I understand you're going to have to go in a minute. Maybe we switch back to Geeta and Betsy and talking about other messaging, and then open it for questions, and maybe we can get some in here before you go. But thank you, Sophia. So Geeta and Betsy.
Sure, and Sophia, feel free to jump in and interrupt us with your time.
It's Sophia.
Sure. Oh, say it again.
Sorry,
Sophia.
Sophia. I said it wrong.
Okay. So Lisa, if you could pull up, we have on one of our slides just a couple of the ideas. So, we were thinking about like what makes a teen who has initial hesitancy change their mind, because I've certainly had many change their mind at this point and have gotten vaccinated who said, no initially. And, the picture here is a young man who actually is the one who was on the audio clip, although it was a woman, his friend who was interpreting. But he was very much, he had a lot of reasons to not get the vaccine. And then, 3 weeks later or 2 weeks later, he was at our King Middle School vaccine clinic when we did, outreach to teens specifically, and kind of made teen appointments for a couple hours. And he was there and he was as happy as could be. And, then decided he would take a picture holding a sign saying, I got my vaccine at GPH, which we just thought was like, so fascinating. So I asked him, what made you change your mind? And, of course, it's what we know with like health behaviors with teens in general. It's peer influence. And it's exactly like, what you said about like social media, like, you know, it was that his friend who, you know, was with me in the clinic room, she decided she was going to get hers. And then she told him like, come get it with me. And we, you know, he could just walk in with her at that time because we had vaccines. And so he came. And he also mentioned, you know, that he had started working in a healthcare facility with elderly, basically, and he had felt like it was the responsible thing to do. So that was the other reason. But really, you know, it's his friend who sort of just like brought him along. And I think that that's what we're seeing, you know, that is the key decision change for a lot of the teens I'm seeing. And then the other point in counseling that is huge is that, you know, you are less likely to be in quarantine because once you're fully vaccinated, you don't have to quarantine the same way. And really like explaining what that means, because teens don't necessarily know that guidance. And so kind of like even pulling it up with information in front of them and being like, so, you know, have you had to be quarantined this year? And what was the reason? Was it through school? Was it through sports? Was it through something else? And you know, that won't have to go on. And some people have had so many quarantines for school that this is a really big motivation to get the vaccine, to not miss those opportunities that they really miss. And then the third one is like sports is a huge motivator for a lot of the school age teens that I see. And so saying like, you're more likely to get your soccer team to play a full season if you all get vaccinated, because your seasons have been short this year and the teams had to close down multiple times because of a case, but that's not going to be the same. And this is one concrete thing your sports team can do to make sure that you can play a full season. And that seemed to be a huge motivator. And I really think that was the reason that some of the teens that I talked to changed their mind. And I'm talking mostly to 18 to 20-year-olds on this, who are still in school, but ones that can sort of consent for themselves. Betsy, what has made, you know, what do you think makes people change their mind?
I think for sure the peers are a big deal. Like, I mean, I think setting up like, you know, a peer vaccine ambassador kind of, you know, with, you know, recruiting teens to kind of, yeah, get other teens to do it. That definitely works. My community specifically, though, a big part of this is the parent. You know, because again, I've recently getting calls for parents who want to vaccinate themselves and their children, their teens. And it's really come from a need of work and also travel, which leads at the end to quarantine, right? So like a lot of my parents need to travel to Boston to, you know, take care of immigration things. And then the kids as well. So what happens? You come back, you have to quarantine. So that was and a lot of them have family in Boston, in New York. And so that was a very big deal with some of my family saying, you get the vaccine, you're good. And then the other thing is the pressure from some employers who are now starting to say, hey, we want you vaccinated. So that in itself, and people are also like, I had a mom who was so excited. She was like, she takes a picture with her vaccine card and she's like, this is like gold. Like, I'm going to use this, you know, this is going to be part of my resume when I go look for a job. So people are starting to think, you know, for work, I'm going to have to get this. They don't want to get it and they're still afraid, but they have to survive. And I think also the ease, like the pop-up clinic that Gateway is doing, that is excellent. It's super easy. Unlike some of the other sites where, you know, you go and you have all this paperwork. That is a huge barrier for teens and for parents. And I think, yeah, like for some teens, like there are those teens that I'm kind of like their school mom, and I think it made a very big difference, me, you know, getting it and being honest. Like they checked in on me. I didn't lie. I was like, that it seriously, I had a huge side effect with it. Like I didn't feel well, you know, but they saw that I made it through. And it was kind of funny that, you know, after a few days on WhatsApp, they're like, Senora Betsy's alive, you know, like, you know, it was kind of, but at the same, it was funny, but at the same time, it was kind of like, wow, they're really afraid. But I do think getting the word out with teens, WhatsApp is a really good one for parents. you know, and I agree, like Snapchat, I've been doing Instagram as well. It's kind of funny, me and my 53-year-old self kind of trying to promote stuff on Instagram, but I'm using my teen daughter to help me. So those are really good platforms, I think, for getting teens.
Can I interject, and maybe Sophia, if before you go, get your thoughts on this, that going back a couple topics to they think they're going to die, or that it's the really powerful video clip that you shared, Geeta, about you know, that it's trying to eradicate populations, you know, that this and the you referenced it, Sophia, in terms of the misinformation campaigns. How do you respond to that specifically? Like, just no, that's not true. Oh, that's wrong. Like, how do you counter that in a way that they trust what you're saying? And I'll start with Sophia, just because I know you have to go, and then hear others as well.
Personally, what I do is I think a lot of the time I just have a more in-depth conversation with the individual. A lot of the information that they're seeing, it's just a clip or two that's quick information that will you know, that has misinformation or things that are not true about the vaccine. So then my role is for, you know, for me to call that individual, especially during meetings. We have meetings every Friday, and when I hear a teen say, oh, I'm gonna die, or whatever, you know, their reason is for not taking the vaccine, I make sure I follow up with them and talk to them more in-depthly and follow with articles and other information. And also I'm always putting myself as an example too. You know, I said, I've taken it. I know people who've taken it. My boss has taken it. You know, it has no bad side effects, or, you know, yada, yada, yada. So it's just having more in-depth conversation with that particular youth, like intentional conversation that really combats, you know, that information that they've ingested.
Great, thank you.
Yeah, I would agree with Sophia. It really requires a lot of follow-up and being persistent and not giving up. Because look, the thing is, some of the families that I work with, you know, they come from countries where governments did use, you know, medical, you know, a lot was done to them, like hiding like it was a healthy thing or a good thing when actually it wasn't. They do come from countries where medicine has been used in a bad way. So it is distrustful. So it really, it's like Sophia said, it's that follow-up, it's finding other materials for them to look at where they can see people speaking their language, people who look like them, basically talking about it. Like, I know I really, like, I get frequent phone, even now, it's been maybe a month since I got the second one. And even now, people will talk to me. They're like, so how are you feeling? Anything? And I'm like, I'm feeling great. You know, I tell them, I feel like I have a new lease on life. I was like, look, I got my hair done. I got my nails done. I seriously, like, I feel like it's opened up, and people are like, wow, you know. So I think kind of giving them that hopeful view that you can get some of your normal life back is very appealing, especially to teens. Like, you know, seriously, when I showed the girls my nails, they were like, you went to a nail salon? I was like, yeah, because I got the vaccine. They were like, what? So it's things like that. And I think, Sophia, right, like, you develop, like, you know, some of these kids so well that you kind of know particular things to motivate them.
Yeah.
So it's also really, again, goes back to those relationships.
And one thing that I will say quickly before I leave is that I've been pushing people to, like, a lot of people are traveling outside of the state and outside of the country. So one thing that, especially for those who are outside of the country, some airlines are saying, like, you can't come on the airline without your vaccination card. And even vaccine clinics do say that. I don't know if it's completely true, but that also has been one way to get people to vaccinate too. So a lot of the friends that I know are vaccinating just because they can, so that they can get on planes. Nationally, I don't think planes require that, unfortunately. So I think at the federal level, even the state level, I don't want to be too authoritarian, but maybe that's something we can look into, travel guidelines. Thank you everyone so much. I hope you have a great rest of your day.
Great. Well, thank you
Yeah.
for joining
Thanks,
us.
Sophia.
What about just going, well, I'll let you guys go ahead and do you want me to put that slide back at all?
Oh, sure. I think, well, I think we're actually good without it, but so in terms of like the motivation for teens, we were thinking next about sort of like just like strategies and like brainstorming sort of strategies we can use. And one of the things that I found is that that if someone says something to me where it shows like, you know, I feel like this vaccine is going to be used, is specifically like, you know, going to be used to like eliminate parts of the population, something like that, which I don't hear very often, again, because people don't often articulate that to me. But I know that it's there very distinctly from, and you know, the clip shows it, that, you know, in that moment, if there's time, it can be sort of, you know, like drawing on peer influence. So like, do you have a friend who's gotten the vaccine, and can we call them to ask them what they think right now? And, you know, I've had teens actually call other teens while we're together to sort of like get another opinion. And I actually find that that works well. I mean, it takes, you know, it takes time. And sometimes it then, for someone like myself who doesn't speak Portuguese, for example, it means that there's an interpreter on the phone, me, a person in the room, and then another person on the phone. And so it becomes like, you know, a time, it takes time to do that. But I do actually think that that works, because then you're walking them through the process of identifying their own peer who doesn't need to, I don't need to know a name, but, you know, reaching out in that moment, then that person can just give an opinion, and that can almost be enough, you know? And also the opinion of like, well, how bad was it afterwards? Because I feel like people are worried about how they're going to feel in the day or two immediately after. And so they can hear from a friend how it felt. And also then, you know, on the provider side of that, we can sort of make a plan for how to deal with that pain, because they may not have ibuprofen at home, and it's easy for us to, you know, to give a dose to take home and make a plan around that for later if needed. And so I've had increasing luck with that type of strategy and messaging, as long as we can find time to do it.
Yeah, that works. I mean, the other thing in terms of planning, that's a really good point, because I actually had a phone call and I signed a couple of parents and their teens up. But when we signed up, we had to do it in a way that there was space, because the teen helps with childcare. So the mom was like really freaking out, thinking like, you know, if she gets really sick, or if I get really sick, like, what are we gonna do? So planning is actually a really important part of this, because between pain relief and explaining what to expect, but also there's a lot that goes on with my families, a lot. So just going to get a vaccine requires a lot of different, make sure everything is in place before you get your vaccine, because you need to do this and this in case you get sick. You know what I mean? Have you run up with that, Gita? Have kids told you, I really can't get sick right now, I have to wait? Or so?
Yeah, I think, yeah, the question of sort of when's the right time, like I have this coming up or I have that coming up. And I think, you know, messaging that this isn't something like where we expect you're going to be out for days and days and days, and that, you know, some people feel quite well, and some people feel some side effects, but, you know, we can make a plan around that, and you can plan to do your activities. And then, you know, checking in a couple days later, so make, you know, works too, so that they feel like I'll call you in 2 days to see how you're feeling. And if you're not feeling great, like, we'll figure it out. You know, I can give you some additional guidance. I can tell you if it's like okay to go to school or not. You know, we can make that plan. But again, this is the sort of like consistent nudging, right? The like multiple follow-up, which is not the tradition of healthcare visits necessarily, but seems to work. And, you know, similarly, like people in the community have the ability to text, and not providers don't necessarily have the ability to text patients in a HIPAA compliant way. Although I think we're exploring that, which I'm really excited about, because that's the type of sort of, you know, people like youth respond to texting just like they respond to social media. That's how they communicate, and the ability to sort of just check in with someone via text you know, is a nice little nudge as opposed to trying to reach by phone, certainly.
Yeah, I mean, we have like, I know City of Portland has like their CHOWs, their community health outreach workers. And I have to tell you, I work with one specifically who works with the Spanish speakers, and she is, I mean, she has had a huge amount of success with getting people on board with the vaccine. Again, she looks like the community. You speak the language, it's your native language, but again, it's WhatsApp, and it's that persistence. I mean, this woman she gives them a couple of days, then she sends them a little text, hey, what's up? Thought about it? Like, she does not let up. And it's been great, because little by little, she has gotten people to really keep thinking about it. Every time they ask her a question, she'll send them, a resource. She takes the time, but it's like Gita said, it's a lot of time to get kids on board and parents. So.
And so, Lisa, we can pause there just for time, and if you want to sort of open it up, there's some strategies that the school nurses, of course, have shared too in terms of what they've been working on, which also, like others on the call might have heard from local school nurses who are doing a lot of promotion. But we can pause here and see how you want to take it.
Great, thank you. Well, we'll open it up. I'm not seeing questions in the chat, but anybody feel free to unmute with questions. That was really excellent. Thank you. Anybody have a question? I have another one in follow up of my earlier one. I will go ahead and jump in, but anybody, again, feel free to chat or just unmute. So back to that, how do you convince them that disinformation, that wrong information is wrong? So on the immediate fear of it's going to kill me, you point to yourself and say, look, I took it, I'm still alive. What about the longer term things, particularly about reproduction? And we hear that so often, right? It's going to interrupt my ability to have a child or my child's child. That one, you can't prove immediately. So how do you approach that conversation?
Oof, that's a really hard one. I kind of try to focus on, all right, have you watched the news? Or so I have certain moms in the community that post-COVID are not doing well. I mean, really having loads of, there are neurological complications that they're having, cardiac complications that they're having. Really, I mean, horrible. Some of these moms, I do use them. I will ask them, say, can you tell them what it was like to have COVID, what it's like now post-COVID? So sometimes I don't like to really terrify people, but some of these moms, they're really not doing well, and it's all post-COVID. So I do tell people, look, I understand, and my families are very honest. So like, Senora Betsy, you're in a different boat. You're in your 50s. You're not going to have any more kids, and I'm like, yes, I'm very aware that I'm over 50. But, I have to think about what if I do get COVID, that we have to look at what do we know? So I will focus on what do we know right now. And what we know is if you get COVID, we don't know what's going to happen. You can either die, you can have some really bad side effects right away. So I try to kind of focus more in the present and kind of, this is, and it's tough because people are like, but what if? And I'm like, it's tough. It's just really, I just wind up focusing on the present, what we know, and just on myself. And those moms will talk to some of the other moms and say, you don't want this, you should get the vaccine. So those two moms have really done a great job with getting other moms on board. But it's a tough one. I don't know, like, what do you say, Gita?
I mean, I say that, it's, I validate it. And we hear, I hear so many concerns around people's fertility with a lot of aspects of medical care. So that one actually, because we hear it with contraception, right? Well, if I take this, I won't be able to get pregnant later. I've heard it with other vaccines. this is one that I feel like, has spanned other parts of medical care and visits with teens. So I guess I say, I state firmly, I don't think it's going to affect your ability to have children later. There's a lot of rumors in the community around what can affect your ability to have children, and kind of have given a couple other examples of that. And then, like, for example, like contraception, and then I'll say, while we don't know everything, we know that it is pregnant women and breastfeeding women can take this vaccine. And I have friends who are pregnant who have taken this vaccine. So if pregnant women can take this vaccine, just think about that, that it seems that safe. And I've had people sort of feel like pregnant women can take it, but I find it very hard. And I think that I think that I've heard, I think that is a sticking point for a couple of the teens I've talked to, and they haven't changed their mind. So perhaps my answer back wasn't that effective.
Yeah, it's a hard one, because think about it, guys, like we can't really guarantee, right? We can't really say, oh, it's not going to happen. But I do, like what Gita does, I hear them. I'm like, I hear what you're saying. I get it. I know that that's scary, but I'll try to, like I said, focus on the here. Let's work on what we have and what we do know and try to deal with it now. But it's a hard one. It really is.
I'm gonna jump in for a moment because I was speaking with another advocate yesterday who herself is working in communities of color and coordinating pop-up clinics, and who herself has been vaccinated. And she and I were talking about vaccinating our kids. Both of us have teenage children who are now eligible for the vaccine. And what we sort of admitted to one another was, yeah, it was actually kind of scary. We've been talking about vaccine, we've been promoting vaccine, but this was simultaneously really exciting because intellectually we know it is good. And also there is this part of us as parents that is unsure. And I will say, as a mother and as a woman of color who comes, my family's Puerto Rican, there's a legacy of forced sterilization, right? And cancer treatment experimentation, unbeknownst to many in the community. So there is a legacy that it runs really deep. It is a fear that comes up sometimes when you least expect it. What I will say is I think we need to be talking to parents, and I appreciate, that you said that you just validate it, right? We need to validate that those fears are just a part of being a loving parent. I will say I have two children who are eligible for vaccine, and I'll share a screen for a quick second because that's my son. That's my 12-year-old son who got vaccinated on the first day that he was eligible to be vaccinated. And if you look at those big eyes, there's nothing more that I would like than to be a grandmother. One day, not yet, but one day. And so that fear is deep. My oldest child has not yet been vaccinated, however, because on the first day that she was eligible, she was put into quarantine. And the fear that I felt in taking my son to be vaccinated pales in comparison to the fear that I felt waiting for her COVID test to come back. And we need to be able to talk to parents about that piece, right? The reality is, I know that COVID is affecting young people more and more as it goes on, and that it will continue to do that if the variants continue to adapt, right? And so I think that for me, it's about also talking about and weighing those two fears, right? What do we know about the safety? What do we know about what that gives our kids back for the normalcy of their lives? I will say my son had a baseball uniform under there, and he was all about getting the shot so that he could keep playing. But then what is the other fear, right? And the other fear is really, I don't want to see my children get COVID or potentially infect someone else in our community. And so I think we just have to be able to have that more complete and empathetic conversation with parents, because it's harder than, even for me who does vaccine all day long, right? I talk about vaccine all day. That's a real fear. And we just have to acknowledge that with parents.
And it's so interesting though, because, sometimes the discussion with youth about delayed risks you know, is often the barrier, right? You shouldn't smoke because you're going to get lung cancer in 30 years. Like they have this youth inevitable, what do you call it? You know, nothing can get them, and I'm not going to worry about risk down the road. And in this case, they're worried about the risk down the road, not that immediate risk that's right in front of them. You know, I mean, I think it's a good point, Liana, that we need to put that right back in front of them.
You do, and Liana, I'm so glad you said what you said, because my daughter, she's 18 and she's going to college, and I am embarrassed to say that here I am in this group and promoting, just like Liana, the vaccine. And I have to tell you, I was waiting until the last minute, until finally the university sent me a letter saying it's a required if she's going to be on the campus. And I'm embarrassed to say that I was like, oh, thank you, God, I didn't have to make that decision. It was made for me, you know, because again, it's like Liana, like I was, as a parent, really afraid, you know. And again, I do come from, you know, a country that, again, same thing what Liana mentioned. So we have to, aside from the teens, we really do need, because I know with the Spanish speakers, we have to get these parents on board. We really do, if we want for teens and younger ones to get vaccinated.
Great. Other thoughts, questions, other approaches that any of you have been taking with teens and or parents? Let's see if there's Renee, I don't want to put you on the spot, but I will. I think that's
Sure.
yes, there you go. Anything else
Hi.
you're seeing with providers in your practice or patients? I know you guys have lots of cultures and communities that you're serving at Greater Portland Health.
Yeah, so you know, I would say that all the things that have been mentioned this morning, I think are what we're hearing in our other clinic sites as well. In my own practice, so I'm an internal medicine doc, so, you know, not seeing a lot of these young people. But what I've seen is that in the parents who are wanting to be vaccinated and open to vaccination, that really is making a difference in terms of wanting their children to be vaccinated. So I think, you know, the point about talking to parents about the benefits of vaccination is really important, because it is true, you know, even if a parent is willing to get vaccinated for their work or some other reason why it's mandated for them, there's still this trepidation about kids. And so, you know, I try to share my own experience. I have 2 kids between the ages of 12 and 16, both of whom received their first vaccine last week. You know, so I share that, you know, why I was excited about that. And, you know, the things that my kids are looking forward to once they're fully vaccinated. And so just, you know, continuing to have those conversations. But I do think, you know, the themes that we've heard today ring true for the folks that we're seeing at Greater Portland Health. I also think that it cannot be sort of overstated the importance of having community leaders and teen peers who are sort of ambassadors, because those voices are really, really important. I think more so potentially than, you know, their medical provider, depending on, you know, how often they see their medical provider and, you know, what they look like and what their personal experience is compared to what their patient's personal experience is. So I think trying to find ways to have more ambassadors is a good thing.
Yeah, particularly given the comment that was made earlier that doctors and nurses in other countries are not trusted. I mean, you know, every one of our polls, right, that we have here among a largely white, you know, intergenerationally American population says doctors and nurses are the most trusted. So to realize that they are potentially among the least trusted is just a great eye opener.
Yes. Yeah.
I think just this is like in terms of the like ambassador piece of this. I mean, this is where some schools have just done remarkable work very quickly, even as they approach the end of the school year. And so some of the like we work very closely with the Portland Public School high school nurses, of which there's 3 of them, and one who's been in the paper, Becky Bell, multiple times and on NPR for her efforts at Casco Bay High School, which is a small school. So she knows every single student quite well. And as pulled each of the people who was eligible for vaccines, like 16 and older at the time, into her office basically, and has had conversations with them, and then tried to provide them with direct information, tried to have like motivating conversations, reached out to their parents if they were like wanted that, or if they were like, my parents are the ones that don't want me to have it. And, of course, 18-year-old and up is different than 16 to 18 for consent. So sort of, with a key eye on that. And then, in other high schools they are sent out like surveys to see who would want to be an ambassador who's gotten vaccinated. And then are setting up some separate meetings with those ambassadors to see how they can promote the messaging in the school. People have put up like boards in the schools of like reasons why I got the vaccine, and have had students just like write down thoughts, which is, it hasn't been that well received just because they would do that on their phones on media, not on a school board. And then at one of the schools, they're working towards getting more education directly in classes where students are ELL, and bringing in community partners to do so, realizing that, that as we've all experienced, that those are communities that may have more distrust or do have more distrust and need information, maybe, and where information in multiple places, like in schools and communities and homes, where like the repeating of information and sort of asking questions, and also because there's peers in the class, a conversation might, someone might say something that then is very supportive of the vaccine that might have an impact in that classroom itself. Which, I think gets the broader idea of like, my patients want to go to school. They want to help the community and they want to protect others, but they do want to go to school. They want to do their sports. They want to be in school, and they think that it's better for their health, most of them. And so, I think that saying that like this affects how school looks in the fall, right? Vaccines can have a big impact in that. And we don't know exactly how it's gonna look, but that like what you can do to support schools is you can get vaccinated, and that helps. And preparing, like giving schools the messaging tools they need, that is like respectfully can provide students with those messaging. And I think that the Portland nurses have done a remarkable job in a month time of making some of those messages themselves, and finding kids to make videos, and the more that we sort of can make those kind of tools available to schools, then the easier it will be for nurses to have what they need to promote and to reach out to parents without having to recreate those things at a local level. Even though I do think that genuinely the local level materials work incredibly well, that not everyone, nurses don't have time to do that. And so, so thinking about that for the fall as the schools wind down.
Gita, you brought up a good point, because I'm getting a lot of phone calls as to what school is going to be like in September. So I have been, I have been kind of using that conversation to kind of help promote that vaccine, in the sense of exactly what you said. Look, we are planning to go back full time. That's the plan. But if you, and we want to continue that, and it's really for my community, the hybrid model of school and all the quarantine has really taken an economic toll on the community. So right now, every time I get a call regarding what is school going to be like, I'm like, this is what we're shooting for, and you can help us by doing this, so that we can make sure that we can be on, and it ties directly to economic need for them. So that's a great one that I've been using, and people are like, oh, okay. So people are, as a motivator, that school will be open full time is a great motivator.
Super. Well, as the mother of 2 grown children, I can just only imagine what this has been like for both the kids and the parents and all the moms particularly. So that would seem to be a huge motivator. All right. Well, we are getting close to the end of the hour. Are there any other thoughts, questions from anyone on the line? All right. Well, with that, I will say a huge thank you again, Geeta and Betsy, for being willing to join us today, and Sophia in her absence. I think that was enormously enlightening and insightful and helpful. So thank you. We will plan to post the recording of this along with the others that Liana noted earlier on the Maine CDC website. So hopefully we'll have others see it as well. And then we are planning to continue this series right now on a monthly basis still. So we would be back on Wednesday, June 15th. And we're going to be shifting gears a little bit and talking about testing at that point, as well as some of the efforts going on for school testing and pooled testing and all the other ongoing needs we have around that. So thanks everybody. Liana, anything else from you?
No, I will just second thank you to our guests. Much appreciated. It's really, really great to hear from all of you. Thanks for everything you're doing.
Thank you all. Take care. Bye-bye.